All right. Good morning, everybody. Welcome back to Grand Rounds for the Department of Medicine here at Washington University School of Medicine. I'm John Hickman, one of the chief residents. It is my pleasure, as always, to welcome you here on behalf of Dr. Frazier, Drs. Costco, Spencer, and myself. Thank you. And speaking of thank yous, I want to send a big thank you to the department for bringing back breakfast. If there wasn't enough enticement to come down and join us for today's amazing talk, please, if you're online, consider it. We've got some bagels and coffee out there, so thank you to the department. It's a real pleasure to help sponsor the 32nd Annual Holocaust Lecture Series here with the Division of Pulmonary and Critical Care. We've got a great talk, like I said, today. We're going to hear more about our speaker in just a moment. If we have time, as always, there will be a chance for questions. So please, those that are online, send them through the chat. I will help moderate those with our speaker. And everyone here, please feel free to chime in as well. Here to introduce our speaker, we have our very own Professor of Medicine, Dr. Dan Rosenbluth.
Good morning and welcome to the 32nd Annual Holocaust Memorial Lecture. This lecture series was the brainchild of Dr. Stephen Lefrak and was established in 1989 at the Jewish Hospital of St. Louis. This lecture series coincides with Yom HaShoah, Holocaust Remembrance Day, and has explored connections between National Socialism, medical institutions, which often were used by or collaborated with the Nazi regime in order to advance their sinister policies. To this day, the intersection of politics, government, science, and medicine remains an area that medicine needs to navigate carefully in order to maintain its independence, credibility, and morality. We are privileged to have Dr. Greg Eghigian as our guest lecturer today. He is currently professor of history at Penn State University after earning his undergraduate degree in psychology at Bard College and subsequently his master's and PhD in modern European history at the University of Chicago. A major interest of his research has been the nature of power and the relationship between state, science, and medicine, and he is widely published in the field. He is a recipient of multiple awards, including the Price-Webster Prize of the History of Science Society and the Deutscher Akademischer Ostasiendienst and German Studies Association Book Prize for the best book in history in 2017, just to name a few. He is a coveted speaker, and we are excited to welcome him to Washington University.
Thank you very much for the invitation. Thank you very much, Dan, for hosting me. I'm delighted to be here today. So yes, before we start in here, this disclosure statement here. And I want to talk today about medicine in Nazi Germany and talk about some of the aspects of its history, some of which may be surprising or less known or a little more unconventional. So upon its really rather gruesome and well-deserved end, Nazi Germany left in its wake, we know, death, destruction, pain, misery, despair, trauma. It also left behind something else, or I should say the people who made it, the people who acted it out, the people who lived through it, the people who escaped it, the people who survived it, even the people who did not survive it, left behind something else, and that is stories. Is there really another chapter in modern history that has left behind so many accounts, so many retellings of its cast of characters, of its rise, of its fall, of its demise, of its legacy, than the history of Nazi Germany and the history of National Socialism? Many of these stories have now become pretty canonical, familiar to many of us here in this room, I dare say. And I think despite their rather grim details, their retellings over and over and over again, I think they sometimes risk making us rather numb to the horror of that world. When it comes to medicine, there is a story about its role in Nazi Germany that has likewise become very familiar. And before visiting that, I want to first of all go over the details of the scope and substance of the kinds of atrocities committed during the Third Reich, in which involved either clinicians or medical researchers. The first thing we know, right, of course, is from its beginnings as it developed as a movement in the 1920s, National Socialism drew heavily on eugenics, or what was called in Germany at the time race hygiene, this idea that a movement in which it was thought you could regulate, by regulating the reproduction of human beings, you could improve the race, the human race, or in their case, the so-called Aryan race, by altering the makeup, physical and mental makeup and characteristics of individuals in society here. So when we start, there's really kind of, historians of medicine have generally talked about three major areas where medicine was deeply, deeply enmeshed in National Socialism. First was the compulsory sterilization program that was initiated in July of 1933. Under the Nazis, this law that gets passed, one of the earliest ones, the most ambitious ones to get passed, defined a whole group of different individuals as potentially or suspected of being hereditarily ill. There you see the list of the different disorders that fell under that category or those categories. And between 1934 and 1945, it's estimated that around 400,000 people were compulsorily, forcibly sterilized on this basis. The Nazi program of sterilization affected men and women the same in terms of at least the statistical breakdown. 50% were men, 50% were women. This is actually in contrast to other countries at the time that were enacting similar laws, like as in Scandinavia, where 90% of those sterilized were women. But the sterilization program expanded beyond just simply sterilization. The procedure, the operations affected men and women, of course, differently. Sterilization of women was a far more invasive process. So we know that at least 5,000 women died as a result of the operations themselves. Also, we know that 30,000 eugenic abortions were performed. That is to say, that we know of many women who either were pregnant at the time when they were told to be sterilized, or became pregnant thinking, I want to get pregnant before I get sterilized. That was no excuse to the authorities, and they were forcibly administered an abortion. And we also know that roughly around 3,000 homosexual men were sterilized as well, and through castration as part of the sterilization program. Killing, murder. The Nazis referred to this program as the euthanasia program, but it's a misnomer. Here, the aim was to target what was deemed to be and what had been referred to in clinical circles for some time as life unworthy of life, lebensunwertes Leben. And this was designed to target individuals deemed to be incurably ill, deformed in some way, abnormal in some way. The program eventually earns the moniker of the Operation T4, and it starts to be administered in 1939. It aims first and targets first children, and children who are in hospital care or in homes or in some facility of some kind. The way it worked initially was that those children identified, or then later adults identified, who were to be targeted for this operation. Once they were identified, the way it worked was the doctors basically starved many of them to death. In some cases, overdoses of medication, barbiturates, morphine, for instance, were used. And we know also for a while, at least, some clinicians use these as opportunities to also conduct studies, as they said, to watch what happened when you in fact starve someone to death, or watch what happens and how long it takes somebody to die when you administer these overdoses of medications. But over time, it started to be seen within these facilities that were performing these acts to be inefficient. And so they began to adopt new measures. And one of the new innovations was to develop these false or faux showers in which children would be told to undress, go into these showers, and you were going to be taking a shower, but of course, instead, they were administered poison gas. This technology, this technique, which is seen as very successful, of course, later then gets exported into Eastern Europe, where it gets utilized broadly and ubiquitously in the death camps that are set up soon after this. The program was supposed to be very secret. The Nazis the administrators and the officials were well aware that this was a very radical measure, and they believed the German people weren't quite yet ready to take this on and to believe in it. So they wanted to keep it secret, but you couldn't keep this one a secret. It was difficult to keep it secret. And soon, in fact, some people were even speaking openly about it in public, probably the most famous being the bishop in Cologne, Bishop von Galen. At that point, around 1941, the program was supposedly called off. It was not called off. Instead, it was now surrounded by ever more secrecy. But one of the things that happened is many of the staff, the people who've been involved in this program, actually get called up for military service. And so what they do is they get transferred to the Eastern Front, where they help set up the new death camps. They help administer those programs. And the program, in a sense, gets expanded and gets militarized. We know, for instance, when the infamous SS Einsatzgruppen go into Poland and go into Eastern Europe during the war, one of the things they do, and their mission is designed to not engage enemy combatants. Their job is to kill civilians, kill Jews, kill suspected communists and others. But one of the things they do, they also go into things like homes and asylums and mental hospitals and kill the residents there. That's one of their missions. So the program doesn't go away. It simply gets expanded and militarized as time goes on. Estimates are that in the end, maybe something in the neighborhood of about 200,000 people were killed. The numbers are probably larger than that. The last area in which, of course, the Nazis were involved were various medical experiments. Over 80 medical experiments on human beings performed on groups, performed on individuals, defined as racially inferior or expendable in some way, that get performed from 1939 to 1945. These were performed on people with disabilities, Jews, of course, Sinti and Roma, prisoners of war, particularly Russians and Poles, and children of these various groups. The people experimented on were all individuals who were being detained against their will. They were either in camps or they were in clinics and committed to clinics of some kind. The experiments themselves were conducted by mainstream scientists and their students. It has to be also said that not all of these researchers were members of the Nazi Party at the time. The experiments themselves were conducted to study a number of things ostensibly, the spread of infectious disease, the treatment of war wounds, the search for supposedly efficient new techniques in surgical sterilization, treating forms of sexual deviance. All of these things were part of the purpose or the aims of these things. The experiments themselves involved things like high altitude and cold water submersion. You see that here in the top left and the bottom right corner. These were done for the Air Force. The effects of drinking salt water, seawater, effects of injecting things like gasoline and cyanide, injecting caustic substances into the uterus, or administering huge doses of radiation. These were done to study the possibilities of finding, again, new ways of performing sterilizations, and also injecting homosexual men with massive doses of testosterone in order to see if you could cure them of their homosexuality. We still don't have exact figures on the number of people who were victimized by these experiments. Estimates after the war were that 2,000 people patients were killed in the process. A colleague of mine, historian in England by the name of Paul Vineling, who's looked at this, believes in fact that the figure was much, much higher. He estimates that it might even enter into the hundreds of thousands because we've too narrowly defined the phenomenon of experimentation here. So who was involved? Who is involved in all of this stuff? The numbers here are hard to come by to some extent as well. We know there were 58,000 licensed physicians in Germany in 1939 when the war started. A few years later, in 1942, that number had jumped to 76,000. Perhaps maybe only a few hundred were involved directly in the killing operations or in the experiments, the racial research centers, the T4 program, concentration and death camps. The vast majority of physicians, however, were involved in the more mundane aspects of medical persecution. Things like reporting patients suspected of being hereditarily ill, or being called on to be expert witnesses, or provide at least some sort of certification for people who wanted to get married, and licensing, because only Aryans were allowed to marry, and certainly not intermarry with Jews. According to one report after World War II, it was estimated that around 50% of all psychiatrists and neurologists in Nazi Germany were card-carrying members of the party, keeping in mind that to be a party member was a privilege and not a right. Tells us a little bit, perhaps, about the level of enthusiasm that physicians could have in this regime. We know that, without question, the German health professionals and researchers were complicit in the murder, the abuse, the persecution of hundreds of thousands of individuals. So in trying to make sense of how all this happened, a familiar story started to take shape. The story was actually minted, I think, already within the first few years after the war ended, when the Allied military tribunals began to put leading Nazi figures, including doctors, on trial for abusing and murdering individuals during the war. And it was American prosecutors in those trials who really first sketched out this outline of an explanation for these very gruesome atrocities. And over the years, I think this narrative, this story, has become a common way to talk about medicine's complicity in the Third Reich. So the story goes something like this. The Nazis were an irrational, despotic group of thugs. They stormed into power through intimidating and brainwashing the German public, fueled solely by hate and a desire to dominate. They callously went about destroying anything and anybody that got in their way, or what they believed got in their way. Indifferent to human suffering, they tortured and murdered with abandon. And then when recruited to help in these efforts, scientists and clinicians willingly obliged, coldly, calculatedly, out of a combination of political self-delusion and a kind of an opportunism. That's been the common story. I think in a strange way, this story about National Socialism is actually reassuring. The idea here is their cruelty was rooted in a kind of pessimism, a coldness, an unreasonableness that was bizarre, that was unprecedented, that was maybe even outright pathological in some ways. In any event, we can gain comfort in that story because it's them. It's definitely not us. That's not us. That's not who we are. That's them. As Dr. John R. Heller, the man who is in charge of the on-site medical operations in the infamous Tuskegee syphilis study, once said when he was asked by an interviewer about why was it during this whole period of time you were conducting this study, nobody thought about the Nuremberg Code and its principle about informed consent. He said, but they were Nazis. But they were Nazis. The idea here is, right, Germans, doctors went astray. This is at least the implication, I think, because they let their politics get in the way of their medicine. I'm not here to say that this story is wrong or is misguided or incorrect. I far from it. I think so much of it is in fact true. What I want to say today and talk about is that I think it's incomplete. That it neglects certain other aspects of things that went into medical research, clinical work at the time, and some of which might surprise us and maybe rightfully should unsettle us in some ways. So let's take some images. Take these images, for example. These are images promoting what was called the Winterhilfswerk, the Winter Relief Drive. This was an annual assistance program that had been developed first by the Red Cross and another German charitable group around 1930. So 3 years before the Nazis come into power. And the idea was this: in this drive that happened around wintertime, right, donations were collected to help the needy with fuel, with food, with clothes during the cold winter months. The Nazis come into power. The regime actually enthusiastically embraces this program and really pushes it. And by 1939, the winter of 1939-1940, that first year of the war, the program was collecting around 600 million Reichmarks a year in donations. Its director, a guy by the name of Erich Hilgenfeld, lauded it as what he called, it's an affair of the heart, that by prompting Germans to give to those less fortunate than them, it instilled this feeling of responsibility, of solidarity, of love, actually, in those who gave, so that it was more than just simply helping out other people. It was educating people into a morality as well. So interestingly, and you see this also in this image here on the right, this sense of what's very clear is that concern, caring, kindness was not something absent from the National Socialist worldview. These things, however, were very carefully circumscribed by the regime. Let's take a look at a couple of other images now of that same program, right? We could take, first of all, you look at on the far left, right? And here we start to see the ideal of what the people are who are supposed to be giving and who they are, right? Who this program is not for in terms of being the beneficiaries, but who's going to in fact support it and who's going to be bolstered by this. And this is the archetypal Aryan German family. This image on the left already tells you this is a racial program as well. It is not something that exists to the side or off to the margins of the racist projects of the regime. And then you take a look on the right. Take a look on the right here. Very interesting things going on. First of all, the invocation of a man who's performed military service, right? Who now starts to connect the Winterhilfswerk with not only nationalism, but militarism, right? But the other thing is the term. That term that you see there comes up twice in this statement, is this term Opfer, Opfer. Opfer means victim, but it also means sacrifice in German, right? And so one of the things you see being invoked in this is this idea that this is something that is being asked of you that allows you to perform something in which you give up something that is part of you, maybe dear to you, in order to benefit who? This racial community, the entire society of Nazi Germany here. So it's really in these images that the program, you could see, was understood as a kind of a form of honorable, even heroic sacrifice for the benefit of the nation, right? This nation that, however, gets very much understood in racial terms. So kindness, therefore, in National Socialism did not exist despite xenophobia. It bolstered xenophobia. It fed racism. It supported militarism. And these things in turn, it was believed, would then inform what the head of the SS, Heinrich Himmler, liked to refer to as making a decent person. These are the things that a decent person could be in this society. There are, however, other signs that Nazi Germany had other faces that unsettle maybe our comforting sense that they are somehow or were different from who we might be and we are. So take, for instance, the system of incarceration in Nazi Germany. So it's very, very clear, without question, this regime was ruthless, utterly ruthless towards people deemed outsiders and deemed adversaries. Delinquents were imprisoned, convicts executed, political opponents placed in concentration camps and tortured. Jews and other people deemed to be racial enemies were hauled off to death camps. Outsiders in this world were cast off as foes, as people to be set aside, to be isolated, to be conquered, to be annihilated, without question. And yet, at the exact same time all this is going on, the regime also showed a remarkable interest in something else that just seems to not fit the picture, and that is correctional rehabilitation of convicts. The Nazi criminal justice system relied heavily on forensic psychiatrists and educational psychologists to help do two things: help identify lawbreakers who they believed could be helped through various kinds of interventions, and then to help design those kinds of interventions in the criminal justice system. And so clinicians, for instance, regularly offered judges their expert testimony on things like the work habits of individuals who stood before the court, on their personality features, on their family lives, to argue that these people were not lost causes. This work was referred to as social prognosis, which really testifies to the fact that this is all rooted in a clinical conceptualization here, right? And of course, the people doing this are themselves physicians and neurologists, right? Psychiatrists and neurologists. Criminologists argued that what you could do, therefore, is provide incentives, instruction, hard work. Hard work was always thought of as being very, very helpful for those who needed to be introduced to a new way of thinking about themselves and their character. All of these things were thought to be ways in which you could succeed in getting, at least some cases, to deepen in them a sense of responsibility among convicts here. So sure, it was acknowledged. A lot of inmates were lost causes. They were hopelessly incorrigible. But there was a great number of people, it was thought, and it should be said, this included in concentration camps, who it was believed and who clinicians believed could fall into line, could be put back into society and become contributing members of this new racial community of Germans, right, into the general population. And in another twist of all of this was the logic behind one of the more infamous aspects of Nazi criminal justice, namely its introduction of mandatory castration of habitual, mostly sexual offenders. The term used was Entmannung, kind of de-manning, I guess you'd say, as it was called. Entmannung, castration was not intended to be a punishment. It was not intended to be punitive. You see, you could tell it wasn't in the way it was conducted, because the people who most didn't like this program were police and prison officials. They thought this was going soft on crime by allowing men who would be castrated to be reintroduced into society after this, right? But it was reserved for people deemed to be convicts determined to be good candidates for rehabilitation and reinsertion into society. It's clinicians who did the evaluations. They conducted the follow-up assessments about how these men were doing after the operation. And it's surgeons, of course, who performed the operations. All told, it's estimated that maybe around 2,400 convicts were castrated under these provisions. In all of this, however, in this criminal justice system, we also have to keep in mind, Jews are basically excluded from all of these rehabilitative measures because, of course, Nazi German ideology and thinking said Jews were irreparably, categorically irredeemable. They could only be eliminated. And so they do not fit that model. They are not included as part of all of this. So National Socialism really relatively comfortably thrived, all embracing all at once really both this hope of redemption for some people and a pessimism about the need for eliminating various groups of people. And so to the true Nazi believer, the Nazi true believer, there was no contradiction in any of this. But this world whose moral compass now was to point in all sorts of unexpected and frightening new directions really started to force very dreadful decisions on the part of individuals in everyday life. Perhaps they weren't true believers at all. Maybe they only believed in half of the party line. Maybe what they were is, like many people, just apolitical. They just wanted to keep their head down and just wanted to get through it all, right, on an everyday basis. But they now had to make choices. They now had to make choices and do the moral calculations. Here, an iconic photo. I should have showed you the bigger photo here, but this has become a rather iconic photo from 1936. Hitler visits a shipyard for a new ship that's being launched in attendance. And they're singing a song, and everybody has the Hitler salute, the Hitler greeting, except this man. We don't know. We have ideas about who he might be. There's different ideas about who he might be. But surrounded by all of these people, here's one man who made a difficult moral choice to stand out in a crowd, in a flood of Hitler greetings. He stands with his arms folded, right? And you can see by some of the faces, if you look to the top, just above his head, you see at least one man looking at him, glowering at him, saying, what on earth is he doing? You're not doing something, was doing something, right? Tough moral choices to be made in all of this. One group that faced these kinds of dilemmas in medical settings were nurses. We know that hospitals and asylum nurses were very much involved with and did so without organized protest in the killing operations of patients, of disabled patients. It should be said that no physician was ever forced to take part in the killing operations, the so-called euthanasia program. It was entirely voluntary. But for nurses, this was a more complicated thing, right? Historically, nurses have had a historical status and a role that goes back to the professionalization of nurses in the 19th century with two missions. They had two missions already get minted in the 19th century. Your job is to care for and comfort patients on one hand and to serve doctors. That's it. That position, that position of subordination, right, made their situation certainly more precarious. That said, we still know nurses did, in fact, help administer the sterilization program, and they were well aware of the killing operations that were going on in clinical settings. Those involved in those operations would later on go on to say that what they did when they were doing it was that they looked for and tried to find ways to avoid getting involved. We don't know if we can truly believe all this in all these cases, but there seems to be a good deal of an element of truth in a lot of their testimony on this count. So they said what they would do is kind of self-isolate, just disappear when maybe you might be asked to do something for the operation, right? Displaced responsibility, a very common thing. What could I do? I'm a nurse. The doctors make those decisions. I don't make those decisions. Indirect participation. Let me try to get involved in aspects of the killing operations that don't involve me actually having to be there for it, or maybe I do maybe I shuffle paperwork instead for this procedure in this case. Or what they often talk about was they sought out spaces. What they would do is try to compensate for participating in the killing operation by doubling down on finding spaces where they could really get involved in doing nursing, right? Caring for patients in what they felt to be a more lasting way in some fashion. Now, of course, health professional, healthcare is not really only the concern of health professionals. The front line of care historically has always been the family. That's where the front line has always been. And here too, the stories and the dilemmas are really, really troubling. There is ample evidence that we have that patients and their relatives were well aware that German medicine was engaged in the mass killing of patients, of those deemed to be somehow incurably disabled or ill in some way. And yet what we know is that most of the patients committed to psychiatric facilities during the last years of the regime were actually living at home when they were committed, and then they were accompanied by a family member to their intake when they arrived there. Now we know patients and families seem to have largely trusted their personal physicians who recommended commitment. That seemed to be a big important thing. So family physicians played a big role. They tended to kind of reserve their distrust for institutional physicians, for health office physicians, the police. Police played a very big role in psychiatric commitments in Nazi Germany. And there's some evidence that families tried to steer their family members from being put into state facilities because they felt they might be safer in private facilities. But nevertheless, we know families did commit mentally ill members of their families despite knowing or suspecting that their death would be imminent. And you've got to ask the question, why? Why would someone do this? Why did they do it? And the evidence points to the fact that the commitments were used to do something that again goes back since the very beginnings of asylums in the 18th and 19th centuries, and that is to solve family problems, to solve family dilemmas. Sometimes it was the fact that, as one man said, his wife was no longer doing household chores, wasn't holding up her end of the marriage, or that an elderly member of the family was becoming disoriented, was becoming more bothersome, was not able to be controlled, running out oftentimes into the streets and putting the family on the radar of the police. Maybe it meant that a family member made it impossible to follow police protocols during air raids. These were called the Verdunklungsvorschriften. The rule being that, right, at nighttime to help disguise and camouflage large populations, pull down your shades, turn off your lights, right? That kind of thing. Maybe that became difficult to do with certain family members. In some cases, they worried about violence of their family member, particularly suicide was talked about. And so in these cases, what we see from what we know from historians of medicine is we see how family security became the priority for people. In other words, this fear that you have this unruly, maybe dangerous, maybe disruptive family member who might hurt him or herself, might be unable to hold up their end of doing the chores during a difficult, might threaten to put the entire family at risk in getting in trouble, right? All this led relatives to see hospitals as a kind of refuge. Difficult. So we see then, when we look more deeply into medicine, clinical research, and healthcare, I think during the Third Reich, it was not so much the case then that doctors, nurses, families didn't care. It was I think really what it was really rather a matter of how they cared, how they expressed their care. National Socialism redirected care and kindness away from some and toward others. Many in Germany, I think we have to say, certainly welcomed this kind of redrawing of the moral compass, if you will, that now started to break down people into friends and foes. You had these friends who were worthy of help and worthy of pity, and yet foes who deserved indifference and deserved reprisal. The Nazis, as Hitler himself said, the Nazis replaced what he called Mitleidsmoral with a Herrenmoral, with a morality of compassion gets replaced with a morality of domination. Others, however, may not have agreed with what was now a fairly cruel distinction of in morality. But of course, they found themselves having to accommodate it. They had to navigate this world. And this is what authoritarian societies do. Not only authoritarian societies, it should be said, but authoritarian societies do. They tend to force horrible choices on the people who have to live inside them. So as a conclusion, as a historian, I have to say, I don't subscribe to the idea that there are always clear-cut lessons to be learned from history. I think circumstances are always different. It's too easy for us to, us in the present, I guess I should say, to shake our heads and wag our fingers at people in the past and talk about how misguided they were, how stupid and dumb they were. But we ourselves remain very much ignorant of their circumstances, their situations, the historical realities they face. But I guess I would make one observation by way of conclusion. Ethics are more than just a thought or a rationality, more than a principle, more than a feeling. Ethics are like love. They are defined and measured by actions, something in practice. So care and kindness may seem, I think, easy to define, very simple things to identify, but we have to understand they often carry with them, in fact, always carry with them, presumptions. Just think, for instance, as a colleague of mine has said, just think of something like the ideal of maternal care. Maternal care. It is a concept which has helped reinforce the ideal of the nuclear family, and it has also probably, in many occasions, made it difficult for people to recognize the existence of something like postpartum depression, right? These things of care and kindness, they sometimes have, in fact, supported racism, violence, certainly condescension. All you have to do is look at the public health movement of the 19th century to see examples of that kind of condescension of the middle classes on the working people. What Nazism and Nazi caring, really, if we wanted to talk about that, really lacked, in fact, it outright despised it, was recognition and appreciation for really our shared vulnerabilities as human beings. To people like Hitler, indulging in such things was a sign of weakness. And I think in our world today, where we have expressions where people expressing concern, sympathy, love, caring for others often now get dismissed as indicators or indications of spinelessness, of frailty, of weakness. I think we might actually revisit that morality that Hitler so despised, that concept again of Mitleid, as it is in German, Mitleid, compassion, right, or sympathy. Literally, the term is mit with, Leid, suffering, right? Suffering with, maybe suffering alongside of or whatever, but suffering with someone, right? I wonder if, in fact, that might be the beginnings of a way to start to recover our sense of shared vulnerability. I want to thank you very much for attending today. Thanks.
Thanks, that was great. Just one question I was interested in the rehabilitation of prisoners. Do you think the motivation for that was true beneficence, or was there also a realization that if the Nazi war machine was going to progress and be successful, they need as many able-bodied persons as they needed, and this was maybe more of a compromise than anything?
Yeah, good point. Well, in fact, that program was well underway way before the war even starts. Not to say that the Nazis didn't know, or Hitler didn't know he was going to go to war at some point. And it certainly was bolstered or reinforced by this notion that all hands on deck. Germany needs to recover from this economic crisis it's been in, and from, of course, what was considered to be the failings of this republic that was now dying. So there was this, to be sure, this sense that we need everybody who could be available to be available. But I think it goes back to, again, the concepts of eugenics. And how it played out on an individual, but also a population level at the time. We often think again that this form of eugenics really just simply said, you're in or you're out. And in fact, in reality, for quite a long time, eugenics, not just in Germany, but really throughout the world, said, but we also recognize it's not that simple. Yes, there are people who are categorically irredeemable, unsalvageable for various reasons. But nonetheless, as historians of medicine have shown, my colleague who I know has spoken here before, Richard Wetzel, has pointed out, they really did take seriously that, however, there were environmental factors that could play a role. And if you just adjusted those, if you just reached the person at the right time and approached them the right way, some of these people could be brought back into society and play a role. So it was built into the very concept of really of eugenics at the time. Yeah. Any comments or questions?
I'll throw one to you from the chat. Bernie asked, was there a national health program? If so, how many policies came from that organ of government? And if not, what government organs dictated these health policies?
Yeah. So there was a national health program. In fact, Germany was, of course, the first country in the world, as far as I know, I mean, certainly in the Western world, to actually enact a national health insurance program. They do so in the 1880s, and it continues on and it gets expanded over the decades ever more. So by the time the Nazis come into power, there is already, close to 50 years of people being used to having a social insurance program that offers fairly extensive benefits, including a disability insurance program. Most of these initiatives, when it comes to the people who are administering and putting it forward, happen at really the state level and public health level. So most of these things, particularly when you talk about the sterilization program, it is a public health program and understood as a public health. And so it's viewed from a public health standpoint. So it's thought of in terms of, in more epidemiological terms, right? When you talk about the killing operation, is murkier. Because it is not something that actually has an official existence. I mean, there are offices that are set up to help determine these things. In fact, doctors are selected to be on boards or commissions, right? Health offices, right? That are going to be given sort of the documentation and the paperwork for individuals who are suspected of needing to fall under these categories of people to be killed. And they do that work. But the program itself, when it gets started, it's not started through some big act of legislation or some big announcement or anything like that. It's done through, in fact, the person who is told to start the program up is Hitler's personal physician. It's not a health minister. It's not the Minister of Interior. It's not anybody like that. So it's done rather informally. And so the killing operation sort of has a foot in officialdom and a foot in very non-official, very informal circles. And then the experiments, of course, are done. Again, there are agencies and institutes and racial institutes that help fund these kinds of things, and the government is interested in these kinds of things. But a lot of this stuff is done independently of that. But there are going to be people who benefit by their proximity to the state and their access to state funding. Yeah.
Another question I would pose to you. You talked about the story that we all sort of have of Nazi Germany and the power. And what would be curious are, do you see any evidence or is there any interviews or history or documentation from physicians that participated in this as to their why or their struggle beyond that?
Struggling with their involvement.
Yes.
Yeah. You have some people who make these arguments. I mean, what we tend to get is in this area, we see a phenomenon that not only was very common with anybody who was typically dragged before a tribunal or a court after World War II, who was involved in Nazi atrocities of some kind, you know, abuse of prisoners of war or whatever. But it's a phenomenon you see time and time again with people who are accused of committing atrocities and human rights violations, is the pointing upward and the pointing downward, as I call it. The people who get before a court who are at the ground level, who may be very subordinate, but are actually directly involved in something like, say, killing someone or performing an experiment on somebody. What they typically would do is they point up. They always point up. It's not me, it's just that my boss told me to do this, or the administrators said it was okay, or things like that. And what then the people at the top often do is say, oh, I've just got some bad apples in my organization. I never would have given the okay had I known so-and-so was doing this, that kind of a thing. So there's a lot of blame displacement. It's a very, very common feature of all of this stuff. Another explanation for the, or I guess rationale or justification that doctors sometimes gave after the fact was the idea that what they were involved with was not really all that unusual. That on an international level, for instance, the sterilization program, they said, well, you know, how can the Americans wag their fingers at us for the sterilization program when you have sterilization in how many of your states, including compulsory sterilization for people who are suffering from particularly certain psychiatric disorders or mental disabilities, right? Who are you to point the finger and say that we've gone too far, we've done something wrong? It becomes kind of uncomfortable. And so one of the arguments that gets made is all of the things we were doing were absolutely not only justified, but were part of mainstream medical research or medical work at the time. And that includes the human medical experiments that were conducted at the time.
Another question in the chat kind of builds on that. Why were the eugenics programs more popular in the world, not only in Nazi Germany?
Yeah, that's a great question. It's an involved one. Very simply, I think it's fair to say, I think the evidence shows that eugenics took a long time to get popular. Eugenics gets minted really in the 1860s and 1870s. It's out there for a while. It's not, I don't think the evidence tends to show internationally it was unusually popular for many decades. But I think what helps egg it along are a couple of things. First of all, eugenics, when it does get popular, it gets popular across the political spectrum. Eugenics generally seem to offer the idea that most of the big public problems, social problems we are facing, have a real easy answer, namely it's heredity. And we just control that, everything else falls by the wayside. That is of an alluring message to not only people on the right, it's appealing to people on the left, it was even appealing to people in the center. Few organizations, few institutions had a problem with it. Probably the largest one that voiced its opposition, now shouldn't surprise us, was the Catholic Church, right? So that's one of the things. The other thing is, I think, especially in Germany, you see its popularity rise in the 1920s. And I think there you have to look at the demographic disaster that was World War I, combined with the economic situation, which meant that budgets, right, federal budgets and state budgets were really depleted. They had few resources. Eugenics is easy. If you say to people, I can solve social welfare problems, I no longer have to dole out unemployment checks or put people on some sort on the dole, but in fact, with a simple operation that doesn't cost a lot, we're going to eliminate all of those problems within just a few years. It's a very alluring idea, and that seemed to also feed it. Yeah. So some hands up over here. Yeah.
So I really like the talking, especially about the families having to make these really hard choices, and I felt a lot of parallels to like patients I've had, like maybe they're undocumented or they're trans or they have like they're unhoused, like all these people who are wrapped up in these systems that kind of oppress them from our own government, and like then they don't want to come to medicine because they're afraid we're going to report them or do something within the system. Did you find any good examples of like physicians or medical personnel in these systems having effective resistance to anything like that, like not just going along with it or pointing blame, but actually like protecting their patients from these systems?
Yeah, there are examples. I heard directly from some people who had family members who were protected in that way. But there are stories. There are stories of directors of certain clinics and all who were known to have been the people to word either spread that these were kind of safe spaces, or that maybe a word was whispered to a family member and say, look, get your patient, get your family member out of that state hospital, bring them over to our place. They're going to be safe there. So there were, in fact, places that were, and individuals who were known to be at least receptive to providing some sort of safe haven or refuge. Another thing that I know from a personal example was of a colleague years ago who told us about one of their family members who was in a state facility. And he said at some point they caught wind of this and they took their family member out and said, we're just going to not keep them there, or you know, but what it meant is also don't go to the doctor because the doctors are under obligation. They're legally obligated to report you. So we're going to take them out of the facility, and then that's it. We'll take care of this individual in our family. So yeah, there were those opportunities. Yeah.
Just to offer you an opportunity to diagnose a room of physicians for our personalities and values, but I read, and Robert J. Lifton pointed out, that physicians, and you pointed out, were one of the professions with the highest numbers who joined National Socialism, often voluntarily, as you noted. Do you think there's something about the mind of physicians or healthcare generally that kind of bought into National Socialism and bought into their practices more than other professions?
You want to get me in trouble, don't you? No, I think you know, the way I view it, and I don't think it's just me, I think other people view it this way as well. It's that it's a perspective on the world. The National Socialists basically said, we understand society, social problems, and the answers to social problems through the language and through the mindset of biology and medicine. That is basically the heart, the core of our idea and our ideology. And so that message, I think, is strikingly familiar to physicians, to people in the healthcare professions. It's a comforting world to live in. And one of the things you also know is you are important. The things that you do, the research you do, the work you do, you are at the very center, the very heart. You're the center of gravity of this new society. That's an alluring message. And so I don't even think you have to be an opportunist. You can just say that people will, I think, found in that something that spoke to them and could speak to them across a lot of different divides. Yeah.
You think that may have been the pull, and the push might have been the fact that a disproportionate number of physicians in Germany were Jewish, and so they were economically threatened as well.
No question about it. And we see this with other professions as well, we have to say, right? But that Gentile physicians and Gentile shop owners and shopkeepers benefited enormously by the dismissal and persecution of Jews, right, in Germany. And so there's no question there was professional benefits to be gained by these anti-Semitic measures. Yeah. think that's about it, right,
Yeah,
Dan? And we're
in the
about
interest of time,
9.
We'll have to call it there. Let me say thank you so much for joining.
Thank you.
For really
Thank you.
important talk. Great, thank you to the pulmonary critical care for bringing us the 32nd annual Holocaust lecture on this very important day. We really appreciate your time.
Thank you.